novel coronavirus COVID-19, 2002 SARS, 2004 MERS, Middle Eastern Respiratory Distress Syndrome, and 2019-2020 we are still battling on with COVID-19 SARS-CoV-2. I'm just going to give you a brief timeline. 2019 December 31st, China reports clusters of pneumonia in Wuhan province. 2020 January 7th, identified as novel SARS-CoV-2. January 9th, first death in China. This was reported. January 12th, genetic sequence was identified. January 13th, first important case in Thailand. January 21st, human-to-human transmission confirmed as an important date. January 25th, confirmed cases in Australia, France, Malaysia, and Canada. January 30th, WHO Health Emergency of International Concern 2019 nCoV acute respiratory disease was mentioned. February 2nd, first death outside China in Philippines. February 8th, 800 deaths worldwide. And February 10th, 909 deaths worldwide. That was a MERS and that was a SARS. February 11th, WHO official name was given as a COVID-19. February 26th, first case in South America and Brazil. February 28th, WHO raises global risk of spread from high to very high. March 7th, 100,000 cases worldwide. March 11th, WHO pandemic was declared. That's again is an important date. March 11th. March 13th, Europe epicenter of pandemic. April 2nd, 1 million cases worldwide, more than 1 million. April 10th, 100,000 deaths worldwide. May 9th, 4 million cases worldwide. May 14th, 300,000 deaths worldwide. So I think one of the colleagues within our team has said that 31st of December 2019, 21st of January 2020, 10th of February 2020, 11th of March 2020, and 14th of May 2020 are significant. These slides would be sent to all of you all. It's coming out along with the lectures. I think you can have a glance at it and make your answers. Pathophysiology. The virus enters via the ENT. That's a transmission route. There's a spike proteins on virus bind to ACE2 receptors and enter the cells. In the lungs, inflammation leads to pneumonitis, reduced oxygen saturation, and acute respiratory distress syndrome commences. There is cytokine storm, inflammatory response, and increased heart rate. These are some of those things Professor Godwin Simon, Professor Tyre Akhtar, and Professor Indra Birdie, and they've all given the lectures on this in the past YouTube. You must listen to them. These are short YouTube, very quick, 5 minutes. You can easily listen to the salient vital points, which is useful for your exams. Then there is a blood vessels leak, fluid, kidney failure, multi-organ failure. ACE2 binding on blood vessels lining, that causes the blood clots, MI, and cardiac damage. That's where hence you have anticoagulation medication started, various anticoagulation you should know, and their role. Symptoms, typical. I call it at the first rank. It's always important for you to make certain way of reading and studying yourself. You must always make something which is comfortable to you. I always, any symptoms, way I study, I look at it as first rank symptoms, and then I look at the other second rank or other symptoms, and then try to coin the two to remember for myself. Typical, fever, persistent dry cough, fatigue, shortness of breath, sore throat, and headache. These are mainly the typical ones. Atypical ones are the diarrhea, as I told you, distorted taste disturbance. Complication, acute respiratory distress syndrome. Number 2, blood clots, vasoconstriction. There is bowel infarction, myocardial infarction, and kidney failure. Pre-symptomatic. Incubation period is about 5 to 14 days. You would have heard a lot about it. You do know self-isolation, 7 days, 14 days, how you got to do all that. Can be symptom-free for up to 14 days. Hence, the 14 days isolation or quarantine came into existence. Then the still infective even with a pre-symptomatic phase. Asymptomatic, they say 18 to 30% of all cases would have no symptoms, but they could still be infective. Again, there is a lot of hypothesis and postulation and various type of experts' views on that. But you must know asymptomatic, if 18 to 30% is asymptomatic, that's almost close to one in three. So that's important for you to understand in some of the questions. As I told before, reproductive zero, this is the rate of transmission. These slides will come to you. Aim is below 1 to prevent exponential spread. That's the aim. And then the factor in determining easing of lockdown measures. This is where the lockdown comes into play. The globe is presently under lockdown. A lot of countries at the various levels. You must learn about various countries, the policies, constitution, the way they have been placing their lockdown and the way they ease their lockdown. This applies to New Zealand. You must read about it. Read of the constitutional right, the way of management planning. You must look at the United Kingdom. Sweden is different. Germany, France, China, Singapore, Taiwan, US. You must read, and you must. There's a lot on those ones which I'm not covering in this topic. Testing. And that also you must know that Germany did the maximum number of testing. South Korea is another. It's a global turnover point. I mean, they have done wonderfully well. You must read about how they were doing the testing and what testing means. What is the validity of it, specificity, sensitivity, all that you need to know for your basic exams. Testing, antigen. That's the presence of infection and is a throat and nasal swab. There are 2 swabs are taken. And the next one is an antibody which is taken out of the blood. IgG and IgM. You must know the IgG when it comes. When does the IgM comes? Which starts quick, which comes after 7, 10, or 14 days. I'm not answering that. You need to read that and know that. Antibody, presence of immunity. It cannot guarantee long-term immunity. UK government approved system is the Roche, but it's for UK. But if you're studying, if you're going to answer this in your countries from Georgia, then there might be some different testing would have been approved. Treatments. Fundamentally, there are 6 which I'm going to cover. There are competing, lots of pharmaceutical companies. I'll cover some of them now, and there'll be another series of lectures on all the pharma industries and all the studies which are being carried out now, and I'll be talking about that later in another series of slides. Treatment, convalescent plasma, number 1, lopinavir plus ritonavir, number 3, vitamin D and vitamin C, and number 4, remdesivir, number 5, ivermectin, number 6, hydroxychloroquine, azithromycin. Mode of action, antiretrovirals. These are the lopinavir and ritonavir inhibit the HIV-1 protease by binding to enzyme active site. From there, it prevents cleavage of the GAG pole polyproteins. And from there, it goes into immature non-infectious viral proteins. That's where the mode of action of these antiretrovirals. So thereby, it prevents subsequent infection of susceptible cells, the cells which are now going to be loaded with the virus. No effect on cells which are already infected. So there is protection to the new cells getting infected or susceptible new ones, but the old ones would not have any great effect on the antiretrovirals. These are some of those RCT trials which have been done at the various hospitals, the various protocols. Mode of action of remdesivir. This I call it Gilead Sciences, or Gilead Sciences. So it's a company now being very highly documented. Everyone reads about it, and this particular drug has given a pretty much a positive, is in the right direction. That's what the scientists say. We are waiting for that, and we should look at the outcome of it. It is a prodrug of active GS